Today I want to talk to you about medical marijuana. Medical cannabis has been in use for centuries by people suffering from many ailments. While medical marijuana is a hot topic mentioned in the news frequently, the idea and practice of using marijuana as a medicine is not new. In fact, if you were to Google it, you would find that there are accounts of people using marijuana for treating earaches, edema, and inflammation in ancient Greece as early as 200 BC. Currently, marijuana is used for medicinal purpose in the United States to treat cancer, glaucoma, epilepsy, and chronic pain, just to name a few. Medical marijuana laws, such as legality and which ailments it can be prescribed for, vary by state. The possession and distribution of marijuana is against federal law, even when it is for medicinal reasons. However, the trend seems to be that these federal laws are not strictly enforced when marijuana is used for medicinal purpose in compliance of state medical marijuana laws. According to Virginia Code 18.2-251.1, medical marijuana is legal in Virginia for the treatment of glaucoma and cancer, and has been since 1979 when the statute was passed. However, current Virginia law prohibits the use of marijuana for any other ailments, including recreational use. Today I am going to persuade you to support the legalization of medical marijuana in Virginia for additional ailments besides glaucoma and cancer. According to procon.org's official website, Lester Grinspoon, MD, a respected Harvard professor, stated in 2007 that marijuana is effective at relieving nausea and vomiting, spasticity, appetite loss, certain types of pain, and debilitating symptoms. He also said that marijuana is extraordinarily safe, safer than most medicines prescribed every day. And if marijuana were a new discovery rather than a well-known substance carrying cultural and political baggage, it would be hailed as a wonder drug. Some people believe that medical marijuana is just a ploy to advance recreational use of marijuana and a way to desensitize the public's negative view on cannabis. While many recreational users are hopeful that marijuana will be entirely legal in the near future for recreational purposes, there are many bona fide medical benefits associated with marijuana supported by scientific studies. According to the official website for the National Organization for the Reform of Marijuana Laws, more widely known by the acronym NORML, NORML, several recent scientific studies found that cannabis consistently reduced patients' pain levels to a degree that was as good or better than currently available medications. Several of the patients in these studies had cancer, diabetes, HIV, AIDS, spinal cord injuries, as well as other ailments. Based on this, it is apparent that marijuana has extreme medical potential superior to synthetic medications. It is time to overlook the opprobrium of marijuana and expand its use as a safer, natural alternative to synthetic drugs, which have severe negative side effects. Several states have already taken a step in this direction. According to the state of Oregon's official website, in 2010 there were over 55,000 medical marijuana patients in Oregon alone. Of this, approximately 50,000 of them use cannabis for chronic pain, 747 of them for glaucoma, and 686 for HIV or AIDS. This shows that the amount of HIV/AIDS medical marijuana patients was only slightly lower than those who used it for glaucoma. In Virginia, you can get medical marijuana for glaucoma, but not for HIV treatment, even though scientific studies have shown it is effective. According to the California NORML site, California passed Proposition 215 allowing medical marijuana to be used for any serious condition for which marijuana provides relief. It is time for Virginia to follow suit with these other states and allow the medical profession to determine which ailments should be treated by medical marijuana. This can be accomplished by amending Virginia Code 18.2-251.1 so that it does not list specific ailments, but instead delegates this discretion to the medical professionals. If this were done, patients in Virginia suffering from more severe or at least equally severe ailments as glaucoma and cancer will be able to benefit from medical marijuana. This would include HIV and AIDS, as well as other serious ailments. Keeping the present laws unchanged is tantamount to denying medical care to those individuals with severe needs. To sum it all up, medical marijuana has been significantly proven to be more effective and safer than synthetic drugs. I urge you to get involved and support the change of this law. If you would like to help change this law, the easiest and most effective way would be to write state senators, voicing your support for an amendment in the law. You can also write your congressman. This law will not change without our support and the dissemination of information to those responsible for making these amendments. Thank you.